Bio 139 lectures. In this slide, we are going to start the respiratory system. First, we are going to learn about the anatomy of the respiratory. Major function of the respiratory system is to supply the body with oxygen for cellular respiration, and it also gets rid of the carbon dioxide. Carbon dioxide is a waste product which is produced as a result of cellular respiration. And to do this job, respiratory system is closely helped by the circulatory system. And then there are some other functions of respiratory system which are also important. Number one is olfaction. Olfaction is respiratory system. It helps us smell. And then there is speech. Respiratory system. It also helps us talk. What is respiration? Respiration, it involves four processes. Two of these processes, they are done by the respiratory system, and two of these processes, they are done by the circulatory system. So for the respiratory system, there is pulmonary ventilation, which is known as breathing in simple words. It is movement of air in and into and out of the lungs. And then there is external respiration. So respiration, it is the exchange of oxygen and carbon dioxide between the lungs and the blood. And then there are two more steps which are done by the circulatory system, which is transport of oxygen and carbon dioxide in the blood, and internal respiration, which means the exchange of oxygen and carbon dioxide between the systemic blood vessels and the tissues. Let's see on this diagram. So the first step is pulmonary ventilation. Pulmonary ventilation, in simple words, we call it breathing. So ventilation, it consists of inspiration and expiration. What is inspiration? A movement of air into the lungs from the atmosphere. So when we breathe the when we breathe the air in, it is known as inspiration. And when we exhale the air out, it is known as expiration. And then the second step is external respiration. So now the air has come into the lungs. So now in the lungs, the oxygen diffuses from the lungs to the blood, and then the carbon dioxide, it diffuses from the blood to the lungs. So this process is known as external respiration. And then the step number 3 is transportation of these respiratory gases to rest of the body, and this is done by the circulatory system. Oxygen is transported from the lungs to the tissues of the body, and then carbon dioxide is taken from the tissues of the body and it is brought back to the lungs. This step is done by the circulatory system. And then the step number 4 is internal respiration. Internal respiration means that the oxygen, it diffuses from the blood to the tissues, and the carbon dioxide, it diffuses from the tissues to the blood. So this is the overall picture how respiration it happens. Let's start by learning about the functional anatomy of the respiratory system. So respiratory system, it is divided into upper respiratory and the lower respiratory. The organs in the upper respiratory system are nose and the nasal cavity, paranasal sinuses, and the pharynx. And then the lower respiratory consists of larynx, trachea, bronchi and their branches, and then alveoli in the lungs. So lungs and the alveoli. This figure shows where different parts of the respiratory system are. So this is nose and the nasal cavity, and then this is the pharynx, and then after the pharynx there is larynx, and after larynx there is trachea, and then this trachea, it divides into two bronchi, and these are lungs lying in the upper thorax on each side. And this muscle is known as diaphragm. This muscle diaphragm, it separates the thorax from the abdomen, and the lungs, they are sitting on this muscle diaphragm. So we don't consider these muscles as part of the respiratory system, but these muscles are important in breathing. Then there are also intercostal muscles. So this is the anatomical location of the respiratory organs. Now let's quickly go over the upper respiratory system. It is not very complicated, and so we will just swiftly go. In upper respiratory system, we have nose. Nose includes the external nose and the nasal cavity. So the external nose, it is made up of bone and cartilage. We know it has a bony part and then it has cartilaginous part. And the internal nasal cavity, it is divided by a midline nasal septum, and it is lined by the mucosa, and then the roof of the nasal cavity, it contains olfactory epithelium. So this is where we smell. And what are the functions? It produces mucus, it filters, warms and moistens the incoming air, and then it is a resonance chamber for the speech, and then also it helps us in smelling. Then the paranasal sinuses, they are mucosa-lined, air-filled cavities in the cranial bones surrounding the nasal cavity. And what is their purpose? They lighten the skull, and they also warm and moisten the incoming air. And then we have pharynx. Now pharynx is, it is a passageway connecting the nasal cavity to the larynx and oral cavity to the esophagus. So this pharynx, it is shared by the respiratory system and the upper parts of the digestive system. And there are three divisions of the pharynx. The uppermost is the nasopharynx, then oropharynx, then laryngopharynx. And it also has tonsils. Tonsils, there is a ring of tonsils around the pharynx, which are a part of lymphoid tissue. And what is the function of the pharynx? It is a passageway of air and food, and it facilitates the exposure of immune system to the inhaled antigens. If you recall our lymphatic system, when we did lymphoid organs, we said that lymphoid tonsils are part of the lymphoid organs, and in the lymphoid organs, T and B cells, they are sitting, and then they are antigen presenting cells which expose the pathogen to these cells for immunity. Let's quickly go over some of the features of the nasal cavity. So our nasal cavity, it has a nasal vestibule. So nasal cavity superior to the nares or the nostrils is known as nasal vestibule, and it is lined with hairs that filter the coarse particles in the air. And then rest of the nasal cavity, it is lined with mucous membranes. There are two types of mucosa. There is olfactory mucosa. Olfactory mucosa is present around here because this will be our it's closer to the ethmoid bone, and this helps in smelling. And then the rest of the nasal cavity, it is lined by pseudostratified ciliated columnar epithelium, and this pseudostratified ciliated columnar epithelium, it has goblet cells, and those goblet cells, they secrete mucus, and then there are also seromucus glands in the nose. So the nasal cavity, the glands, they secrete some secretions, and those secretions, they contains enzymes. And then this epithelium is ciliated, so it sweeps the mucus posteriorly towards the throat, so it can be swallowed in the esophagus, and then in the stomach we know there is acid, so it can be taken care of. So this is about nasal cavity. And then we have paranasal sinuses. They are around the nasal cavity. This is sphenoid sinus, then we have frontal sinus, and then we have maxillary sinuses on the sides, right, in the maxilla bone. So these are also lined by the mucous membrane, and they help to lighten the skull, and they also have mucus glands. Now let's quickly see some of the features in the nasal cavity. These things, these projections, these are known as nasal conchae. There are three of them: superior, middle, and inferior. And then the slit-like opening under these conchae, it is known as meatus. So they are again superior, middle, and inferior meatus. And this is where the nasal cavity, it is opening into the pharynx. So this is at the back side of the conchae, the nasal cavity is opening into the pharynx. So these are all the things we need to know about nose. So after nose, we have gone quickly over the features of the nasal cavity. Now, behind the nose, we have pharynx, and then there is larynx. It will start around here where this cricoid cartilage you can see protruding. There is larynx, and then it continues in the upper trachea. On the back side we have esophagus, on the front side we have trachea. So this pharynx, it is a common pathway which is used by for the passage of the food. This pharynx, the passage of the food here, and for the passage of the air. Okay, now let's go over pharynx. Now let's talk about pharynx. Pharynx, it is divided into nasopharynx, oropharynx, and laryngopharynx. This is a nasopharynx, which is behind the nose. It is connected to the nasal cavity. It is lined by pseudostratified columnar epithelium, the same epithelium which is lining the nasal cavity. And then there are some tonsils present. These are pharyngeal tonsils. They are also known as adenoids. Many times young children, they get inflammation of the adenoids, and then they have to be removed. So this is where they are located. Then there is another tonsil around here. Then this is the opening which is known as the pharyngotympanic opening, and this connects the pharynx to the middle ear cavity, and it equalizes the pressure in the middle ear. Then there is a important phenomena, because this nasopharynx, it is connected to the oropharynx, the second part of the pharynx, and that oropharynx is in direct contact with the oral cavity. When the swallowing happens, this structure known as the soft palate and the uvula, it closes the nasopharynx, so the food will not go in the nose. Second part of the pharynx is known as the oropharynx. It is the passageway for food and air from the level of the soft palate. So this is soft palate. At the level of the soft palate, now we have oropharynx, and it is also lined by epithelium, and the epithelium is stratified squamous epithelium. So over here it was pseudo stratified columnar epithelium like the nose, but now over here it is stratified squamous epithelium like the oral cavity. And then also over here there are some tonsils present. We have palatine tonsils. These are the palatine tonsils, and then we have lingual tonsils. And then this isthmus of Fosses, what is this? This is the opening of the oral cavity into the pharynx. It just has a fancy name. Third part of the pharynx is known as laryngopharynx. It is located behind the epiglottis, and then after this laryngopharynx, it continues with there will be esophagus, and in the front there is trachea. So what what happens, very common problem in the related to the pharynx is infection and swelling of the adenoids. This usually happens in young children, and because the adenoids they swell, there is blockage to the passage of the air. As a result, the child, he or she, they open their mouth to breathe, so they are trying to skip, they are skipping the nasopharynx, and they're breathing through the mouth, and the air is also not very properly moistened, and it is dry. And when adenoids are enlarged chronically, they can affect the sleep, and they can also affect the speech. We are done with upper respiratory. Now let's start lower. Lower respiratory system consists of larynx, trachea, bronchi, and lungs. It is broken into two zones: respiratory zone, which is the site of gas exchange, and it consists of microscopic structures such as respiratory bronchioles, alveolar ducts, and alveoli. And then we have the conducting zone. Conducting zone, it conducts the gases to the site of the gas exchange, and conducting zone is from the nose till these respiratory bronchioles, and it also cleanses, warms, and humidifies air. We have already covered the upper respiratory system, the nasal cavity, and the pharynx. Now this is our lower respiratory system. This is larynx, and this is trachea. Trachea has incomplete cartilage rings. The lowermost cartilage ring of trachea is known as carina of trachea. At this point, the trachea divides into two bronchi, right bronchus and left bronchus. And then these primary bronchi, they divide into secondary bronchi. Those secondary bronchi divide into tertiary bronchi, and they become smaller and smaller and smaller till they reach this a bronchus, which is named as terminal bronchiole, and after terminal bronchiole we have respiratory bronchiole, and then we have the alveolar duct and the alveolar sac. Let's quickly go over larynx. Larynx is made up of 9 cartilages and some membranes. So this is epiglottis, this is thyroid cartilage, and this prominence is felt as Adam's apple. This is cricoid cartilage. In the side view, this is epiglottis. Epiglottis, it consists of elastic cartilage and it covers the laryngeal inlet during swallowing. It is covered by taste bud containing mucosa. And in the side view, there are also some small cartilages. This is known as corniculate cartilage. Then there is a arytenoid cartilage. Arytenoid cartilage is important because this arytenoid cartilage, it anchors the vocal cord. So if you look on the side over here, this is where the vocal cord is. So this is known as false vocal cord, and this lower portion is known as the true vocal cord. When air is flowing, it is coming in, and there is no food or swallowing happen. This epiglottis, it points upwards, but during swallowing this larynx is pulled up and this epiglottis moves a little. So in this way it covers the larynx, so the food cannot go in the larynx. If something goes in the larynx, we have a protective cough reflex. Now let's see how our trachea divides and what's the fate of the trachea. So trachea, in simple words, it is known as windpipe. It is about 4 inches long and it is very flexible, and at this point it divides into 2 bronchi. Microscopically, trachea has a mucosa, submucosa, and then we also there is adventitia we cannot see in this slide. So the mucosa is pseudostratified ciliated columnar epithelium, and then in the submucosa these are the seromucous glands, and then there is hyaline cartilage. We saw those cartilage circles around the trachea. There is hyaline cartilage. So we know these cilia, with a rhythmic motion, they move the mucus up in the upward direction, and if any pathogen it is stuck in that mucus, it is taken to the pharynx and then it is swallowed or it is spit out. This diagram, it shows cross section, transverse section of the trachea. Over here, the transverse plane. So this is esophagus, it is present behind the trachea, and in front this is our trachea. Trachea is made up of mucosa. Mucosa is pseudo-stratified ciliated epithelium. Then there is submucosa. There are seromucous glands in the submucosa, and then this cartilage, it surrounds the submucosa. Then outside this cartilage we have adventitia. This muscle is known as trachealis. It is present on the posterior surface of the trachea, because at the posterior surface there is no cartilage. This ring of cartilage is not complete. And then the lowermost cartilage of the trachea is known as carina, and it is very sensitive. If any foreign material gets in, we get a cough reflex. This is micrograph of cilia in the trachea, and these cilia, they get destroyed by smoking. So people who smoke, many times when they wake up early in the morning, they have a smoker's cough. So if that person stops smoking, the ciliary function, it usually recovers within a few weeks. Tracheal obstruction is life-threatening. Sometimes when someone is eating very quickly with a very fast pace, a piece of food can go in the trachea, and that can be very dangerous. And it is removed by using the victim's lung to pop out that food. So this maneuver, it is very important and simple, but if someone who has not practiced in doing this, they can end up giving rib fractures to the other person. We have learned about trachea. Now let's talk about the bronchial tree. trachea at the level of the carina. This is carina, which is the lowermost cartilage of the trachea. It divides into two main bronchi or two primary bronchi. The right bronchus, it is shorter, wider and more vertical than the left. What is the significance of this? If any foreign material enters the trachea, there are more chances that it will end up going to the right side, to the right lung, and it will cause problem there. It will cause obstruction there. Now these primary bronchi, they divide into secondary bronchi or lobar bronchi. It means that one bronchus per lobe. There are two lobar bronchi on the left and there are three lobar bronchi on the right, because as you can see there are three lobes on the right side and then there are two lobes on the left side. And then these divide into the tertiary or segmental bronchi, and these bronchi, they undergo 23 orders of branching, and this branching, it is referred to as bronchial tree. And respiratory zone, it begins when a terminal bronchiole, it feeds into respiratory bronchiole. So it keep on dividing till they become terminal bronchioles. And then after terminal bronchioles, we have respiratory bronchioles, then alveolar ducts, then alveolar sacs. This table summarizes what we already went over, and then there are a few more points. So let's see this table. So it's, first of all, we have trachea. Trachea divides into primary bronchi. These primary bronchi, they are also known as main bronchi. Right main bronchus is wider, shorter and more vertical, and inhaled foreign objects get stuck here commonly. And then there is left main bronchus. Then these primary bronchi, they divide into secondary bronchi. Secondary bronchi are also known as lobar bronchi. The right lobar bronchi, we have three, because they're each one lobar bronchus, it goes to one lobe of the lung. And then on a left lobar bronchi, we have two. Then these secondary bronchi, they divide into tertiary bronchi. Tertiary bronchi are also known as segmental bronchi. Then they keep on dividing there till they become bronchioles. When the diameter is 1 millimeter, we say that these are bronchioles. And then these bronchioles also keep on becoming shorter till the terminal bronchiole stage is reached. Terminal bronchiole has a diameter of 0.5 millimeter. Now let's see at the different structures, what happens to the different structures. So what happens to the support structure? How do they change as we move from trachea to the terminal bronchiole? So the trachea has cartilage ring. As we go along this line, the cartilage, it becomes irregular patches or plates, and finally there is no cartilage at the end of these. And then we have then there are elastic fibers. The elastic fibers, they remain the same. So the trachea has elastic fibers, so do terminal bronchioles. The elastic fibers, they do not change. Then what happens to the epithelium? We know in the trachea we have pseudostratified columnar ciliated epithelium. This epithelium, as we move down the line, it thins. It thins out to columnar epithelium, to simple columnar epithelium, and then to simple cuboidal epithelium in the terminal bronchioles. And then what happens to the cilia? Cilia also decrease as we move along. And then the smooth muscle, the amount of smooth muscle actually increases as we are moving along this line. And in the bronchiole, there is a whole circle of smooth muscle surrounding the air tube. We went over the conducting zone. Now let's see the respiratory zone structures. So this is terminal bronchiole. This terminal bronchiole is part of the conducting zone. And then after the terminal bronchiole, this is respiratory bronchiole. Respiratory bronchiole is the respiratory zone structure. After respiratory bronchiole, we have alveolar duct. And then these alveolar ducts, they have alveoli outpocketing from them. These alveoli, this whole bunch is known as the alveolar sac. So if you consider this a bunch of grape, the bunch of grape is alveolar sac, and the individual grapes, they are alveoli. And these alveoli, they are the actual places where the gas exchange is going to happen. And these alveoli, they make up most of the lung volume. So this is, they have cut this alveolar sac, and we can see inside, you will see small holes if you concentrate. These are alveolar pores. So through these alveolar pores, these alveoli, they contact with each other, and in this way they equalize air pressure throughout the lung. And they also provide alternate routes in case of blockage. And this, in this diagram, they have shown the relationship of the capillaries of the blood with the alveoli. See how much extensive the capillary network is here. So important thing in this is that we have to realize that the blood coming to the lungs, to the alveoli, it is deoxygenated blood, right? It has more carbon dioxide in it. So this blue, it is bringing the blood in, and then this red one is the one which is being oxygenized, and then this is going to the heart. So this is the difference which we have to know, and this is where the gas exchange is actually happening. And these yellow lines over the alveoli, these are the elastic fibers. Elastic fibers, they are present in even in the over here, and they keep the airways patent. They keep them open because there are no cartilages over here. This is electromicrograph of a pulmonary capillary. So they have just, you can see how there are capillaries, and just imagine in between there are alveoli, how extensive the capillaries are. Now let's look at the alveoli and the respiratory membrane. First, let's go over alveolus. So this unit is known as alveolus, and the plural is alveoli. These alveoli, they are made up of two types of cells, and then they have a third cell which is also present there. So there are type 1 alveolar cells. These are these flat squamous cells, right? These flat squamous cells with flattened nuclei, which you can see in the cut section and also over here. These are type 1 alveolar cells or type 1 pneumocytes. Then we have type 2 alveolar cells. These type 2 alveolar cells, they are kind of cuboidal, and they secrete a substance known as surfactant. What is the significance of surfactant, and why do we need it here? Because this surfactant, it reduces the surface tension, and it prevents the alveolus from collapsing. Then we have these macrophages. These blue cells are macrophages. So they swallow if anything reaches the alveolus, if any which needs to be removed, they take care of it. And then these macrophages themselves, they are removed. They are taken to the throat, and then they're swallowed through the pharynx to the stomach. So these are the cells of the alveolus, and these red things, these are the capillaries. You see, they are capillaries, capillary network all over. Okay, now let's have a look at this respiratory membrane. So this blood air barrier, it consists of alveolar membrane and capillary membrane. So these two walls, they are fused together, and it is very thin. It is about 0.5 micrometers, and it allows the gas exchange to happen easily. This is the respiratory membrane, this is alveolar side, and this is the capillary side. This is how alveolar slide, it appears under the microscope. So these are thin walled alveoli with squamous cells, and at some places, if we have a closer look, we will see the cuboidal cells, which are the type 2 pneumocytes. And these are the alveoli, and notice the alveolar pores, they have even labeled it over here. So alveoli, they communicate with each other through alveolar poles, and then also these are elastic fibers which are present on the alveoli. Now let's talk about the lungs and the pleura. Lungs, they occupy all of the thoracic cavity except for the mediastinum. In the mediastinum, there is heart, and their apex, it is located behind the clavicle. There is clavicle here, so apex is going behind the clavicle. And inferiorly, if we come here, they're resting on the diaphragm. This is the diaphragm. So the base of the lung, it is resting on the diaphragm. Three of the surfaces of the lung, they are costal surfaces. What does that mean? So this is interior surface, opposite of it will be posterior surface, then on the side is the lateral surface. And these cut over here, these are the cut parts of the costal cartilages. So these costal cartilages, just imagine they are moving forward. So the lungs is behind the costal cartilages and it is in touch with the costal cartilages. So that is why we call them costal surfaces. And then it is resting on the diaphragm, inferiorly the base. And then this is on the medial side, this is the cardiac notch, this is where the heart is. And then lung is enclosed by a membrane which is known as pleura. Pleura has two layers, a visceral layer which is closer to the lung, and a parietal layer which is outside of the visceral layer. We have two lungs, a right lung and a left lung. These lungs, they are divided into lobes. The right lung, it is divided into three lobes by two fissures. So this is the horizontal fissure, and then this is oblique fissure. This is the superior lobe, this is middle lobe, and then this is the inferior lobe. And on the left side, the oblique fissure, it divides the left lung into superior lobe and the inferior lobe. And this is the cardiac notch where the heart is going to be. And this projection, this is known as lingula. Some people say that it is like supposed to be the third lobe of the lung, but this is the left lung has two lobes and the right lung has three lobes. Now let's look at this surface. This is the mediastinal surface, or the surface which is present medially. So this is known as hilum. Hilum is found on the mediastinal surface, and it is where the blood vessels and the bronchi and the lymphatics and the nerves, they enter and they leave the lung. So this place is known as hilum. And then other features on this we already discussed. So let's move. Our right and left lung, they are divided into lobes. The right lung is divided into three lobes by horizontal fissure and an oblique fissure. And the left is divided into two lobes by an oblique fissure. And then these lobes, they are further divided into segments. And we have 10 segments on the right and 8 to 10 segments on the left. These segments, they are separated by connective tissue septa, and each segment, it has its own artery, vein, and bronchus. Remember, we talked about segmental bronchus. So each bronchus goes to one segment. And what is the significance of this? If one segment is diseased, it can be individually removed because each segment has its own blood supply, its own vein, its own set of vessels. These segments are further divided, and the smallest subdivision visible to naked eye is known as lobule. Lobule are hexagonal segments, and they are served by bronchioles and their branches. And most of the lungs, they are composed of alveoli, like we discussed before. Alveoli are present in large number. And other than the alveoli, we have stroma, and stroma consists of the elastic connective tissue. This is just a cast of the bronchial tree, and it is showing like different lobes and segments. Let's look at the transverse section. This is a transverse section. So this is anterior because this is sternum and this is posterior. Here is a vertebra. This is heart, right? It is present in the mediastinum. And then these are the lungs on each side. And this layer, see this double layer, this is pleura. There is a visceral part of the pleura which is closer to the lung, and then there is a parietal part of the pleura, which it is encircling all of this. Now let's talk about the blood supply and the innervation of the lungs. Lungs are supplied by two circulations, the pulmonary circulation and the bronchial circulation. So pulmonary circulation is the blood which is coming to the lungs to get oxygenated, and the bronchial circulation, it is the blood supply of the lung itself. So let's look over pulmonary circulation. These are pulmonary arteries, although they are blue because they have made it blue because they contain deoxygenated blood which contains carbon dioxide. But this is known as pulmonary artery because any vessel that leaves the heart is known as artery. So this pulmonary artery, It goes to the lung. When it goes to the lung, it divides into smaller branches till it changes into the capillary network, and it is at that place the exchange happens. Oxygen is put in the blood and carbon dioxide is taken out, and then those capillaries, they form bigger vessels till they make the pulmonary veins, and these pulmonary veins, they bring the oxygenated blood back to the heart so it can be pumped to rest of the body through aorta. There are four pulmonary veins. All right, and now one of the important things about this is that this is low pressure, high volume system. Pulmonary circulation is low pressure, high volume system. And then the capillaries of the lung, they also they perform some other functions too. They also secrete enzymes, like we have seen that capillaries in different parts of the body, they also secrete some chemical substances when there is need. So the capillary endothelium, they secrete angiotensin converting enzyme. This comes in the blood pressure. We talked about uh, angiotensin renin, angiotensin aldosterone. So this is angiotensin converting enzyme. It is secreted by the endothelial capillaries of the lungs. The second circulation is the bronchial circulation. This is circulation of the lung tissue. So they arise from the aorta and they enter the lungs at hilum. They are part of the systemic circulation, so they are high pressure and low volume. And they supply all the lung tissue except the alveoli. And the bronchial veins, they anastomose with the pulmonary veins, and pulmonary veins carry most venous blood back to the heart. Now let's quickly go over the innervation of the lungs. Lungs are innervated by parasympathetic nervous system and the sympathetic nervous system, as well as visceral sensory fibers. And nerves enter through the pulmonary plexus on lung root, and they run along the bronchial tubes and blood vessels. Parasympathetic fibers, they cause bronchoconstriction, whereas sympathetic fibers, they cause bronchodilation. If any one of you remember that flight, the stress response we did when we were doing hormones, that epinephrine and norepinephrine, they cause bronchodilation. So that is sympathetic fibers, they cause bronchodilation. Lungs, they are lined by the double-layered serosal membrane, which is known as pleura. And pleura, it divides the thoracic cavity into two pleural compartments. So each lung, it is covered by the pleura, and then one mediastinal compartment where there is heart. And this pleura, it has two layers. One layer is known as visceral pleura. Visceral pleura, it is present close to the lung. And then there is parietal pleura. Parietal pleura is the outer covering. It is present outside the visceral pleura, and it goes around the costal wall of the thoracic cavity, and then it goes around the heart. It goes between the lungs, and also because this is a transverse section, it is also here on the top of the diaphragm. So it is enclosing the lungs all over. So this is known as pleura, and pleura has two layers, a parietal layer and a visceral layer. Between these two layers of pleura, the visceral layer and the parietal pleura, there is a cavity. It is known as pleural cavity. There is some fluid in the pleural cavity, and this fluid, it provides lubrication for the lung expansion and recoil. So pleurisy, it is a condition in which the pleura, they become inflamed, and usually it happens secondary to pneumonia. And when they are inflamed, the pleura become rough and it results in friction when the person breathes. So it is very painful. The patient cannot take a deep breath. If they take a deep breath, they just suddenly they stop because it is so sharp pain when because the pleura, it is not providing the lubrication. So this is a chart. It is from your Pearson text. You can go over it. It summarizes everything we discussed in this slide. I want you to watch this video on page 820 of your Pearson e-text. The name of the video is Anatomy Review Animation.